Top Med Talk.
Well, hello and welcome to Top Med Talk. We are here at the EBPOM 2021 World Congress of Perioperative Medicine, doing what we love to do, pop-up interviews with people from around the world and people that are joining us for the meeting. So Vicki Morton is my co-host today. Vicki, thank you for joining us. And we just wanted to take this opportunity to meet a new face for EBPOM and Top Med Talk. And actually, it's really going to be a unique conversation, Vicki. You know, I know in previous meetings when we've been able to get a hold of residents and students, CRNAs and student nurses, but there are very few times that we get to talk to new graduates. Yeah, and so we have a brand new nurse with us today. So why don't you go ahead and introduce our guest?
Yeah, so I would like to introduce Caroline Geary. She is a critical care nurse at Novant Hospital in Charlotte, North Carolina. She's gone through the nurse residency for critical care and just finished up, if I remember correctly. And I want to know, Caroline, hello, welcome.
Hi.
I wonder if you could just tell us a little bit about yourself.
Sure. So I actually went to undergrad not wanting to be a nurse. I didn't know I wanted to go to nursing school till about halfway through. So I finished up my undergrad degree and then decided, I wanted to help people in a very hands-on way, and then went to the University of Pennsylvania and did an accelerated BSN, which was no joke. Very hard, very fast-paced program. So I graduated from that in December of 2020, moved to Charlotte and started work right away as a critical care nurse resident. For anybody who may be unfamiliar with that term, nurse resident, it is a nurse who's in their first year of practice. And many hospitals are adopting this residency program to help new nurses transition from nursing school into being a successful bedside nurse, because there's a huge learning gap that happens in between nursing school and then being in practice. And it's really hard to manage. So I'm a nurse resident, and I am currently working in a medical ICU at Novant Presbyterian in Charlotte.
That is fantastic. I don't know about you, Vicki. My trajectory or my pathway was very similar to yours, Caroline. I got a bachelor's of biology and then decided I wanted to go to nursing, so did an accelerated program and then jumped right into critical care. At that time, they did not have a residency, and I think I'm kind of far removed these days as a nurse anesthetist and not even in touch with nursing education, that these residency programs are being adopted throughout the country.
Yeah, well, so when I graduated from nursing school 25 years ago, it was actually the first residency program, new nurse residency program at the hospital that Caroline was at. And so I did go directly into critical care and into that phase. We didn't call it the residency program, we called it preceptorship. Yeah. But it was the first one of the kind, and was hugely beneficial. And you're right, Caroline, there's a massive gap, knowledge gap between school and actual practice. So good for you for landing that. They're very difficult to come by and to actually get into it. So Caroline, you contacted me, reached out, it's been a while ago now, right? It's been several months, wanting to know more about ERAS. You kind of heard about rumblings of it and gotten some education within the hospital system, and you reached out, you wanted to know more and become involved. Tell us why you're passionate about it, and the conversation we've had, you sounded extremely passionate about it. Mm-hmm. But where did that come from?
So it was a little bit of a combined thing. So from a personal side, I personally had several orthopedic surgeries, and after my last one, now knowing about ERAS, I realized, wow, I could have been a really great candidate for ERAS. My first clinical exposure to ERAS actually happened on my last semester at the University of Pennsylvania. I was in one of the hospitals, and I had I believe it was a cabbage patient, and across their chart, it had the ERAS banner and said, "This is an ERAS patient." And I was like, what is this? So I started Googling it and kind of opened Pandora's box for myself of enhanced recovery. I've always also had an interest in pain management, so this just made sense for me. I started reading up on articles, and I also saw this too, combining with my interest in pain management and the opioid epidemic in our country. And I was just thinking, why isn't this a standard of practice? for all surgery lines, for service lines, why am I graduating nursing school? I'm about to go start a job and I don't know what enhanced recovery is. And I'm about to be taking postoperative patients that really could benefit from enhanced recovery. So I was kind of distraught at the fact that I had just gone through 18 months of nursing school and didn't even know the general idea that we should be getting patients up and mobilizing and all of those details of ERAS that are so important to optimizing patient outcomes.
Did you have any exposure to this before? No, now knowing that you'd never heard of it before, it's concerning. I think Vicki and I have had this conversation a lot lately about how we get to nursing and non-physician providers earlier in their education and training. Since you've been out and your work with colleagues and you're interested in enhanced recovery, are you finding that other nurses are coming out without any prior knowledge of enhanced recovery?
Mm-hmm. Yeah. So I am explaining it to nurses who have been nurses for 5-10 years, which is astonishing. I'm trying to explain it to my new nurse friends. And I think that honestly, it should be obviously not the specific protocols for every surgery. Those shouldn't be taught in nursing school, but the general idea, enhanced recovery should be on the NCLEX. We should be studying it. I mean, seriously, there should be a question.
Amen, sister.
That's right.
There should be questions, that at least if it isn't covered in detail during nursing curriculum, in those review books for the NCLEX, at least you can study it, know the general ideas. And so then when, so many nurses come out of nursing school going straight into the acute care setting, when you get those enhanced recovery patients, which hopefully is in more service lines in the next couple of years, you know what to do. And you can even incorporate those enhanced recovery ideas into the foundation of your practice. That really starts in nursing school.
And that's really a key. What you just said, Caroline, it is working it into the foundation of your practice. And you're right, it should be taught in nursing school because these really are the things that should be done anyway.
Well, let me follow up on that then. So one of the questions that I had too was, basic tenets of enhanced recovery: drink, eat, and mobilize post-operatively. If you're doing those things, usually it means that everything before that was done well, whatever the interventions were. So in nursing school, because I remember in when I was in school and then got out as a brand new nurse, we learned, the best thing that you can do, just any time during, a hospital stay or recovery from an illness or surgery in this particular instance, is get up, walk around. I mean, that's good for bowel function. That's good for your lungs. That's good, for a multitude of reasons. And then, eating and drinking, making sure that you're taking in the nutrients that you need and you're staying hydrated to avoid things like hypotension and all those negative things. Are those basic tenets you feel being taught in nursing school? I mean, because I think that there was a time period when people are like, oh no, they need to stay in bed, or we can't get up. They need an NG tube because they can't eat because they just had a bowel surgery or whatever. What is that? Maybe it's not in the framework of enhanced recovery, but maybe some of the basic tenets are being taught.
Sure. Honestly, we didn't get a lot of post-operative education. It was very, very medication based, and how do you keep your patients safe, and then how do you do procedures, dressing changes, that stuff. And then the pathophysiology, which to a degree included those, but it's never followed through, if that makes sense. I feel like nursing students aren't seeing the why behind exactly why this needs to happen, because patients will have better outcomes. Like it's not just repositioning a patient. It's not just getting them up. Like we need to get them up because they will be able to get out of the hospital 2-3 days earlier.
Yeah, and I think that is the gap, the why. I mean, in any of this, the why behind it is the most important piece. One thing, Caroline, that you might want to think about with your alma mater is calling them up, going back and saying, hey, I'm willing to come and give a lecture to your students about this. They need to know about it, and you need to know about it, and try to change that line of thinking. Queen's University is where I graduated from, and every semester I go back and I give probably 2 or 3 lectures within a semester to the undergraduate and the graduate nursing students, just to bring awareness so that when they go into practice, they have heard about it. So That is, one thing. We do have to somehow figure out a way to incorporate the why and the foundation of enhanced recovery in nursing programs, because we're missing the boat on that. And honestly, it has been incorporated into a lot of the medical school and residency programs, but we're missing the most important group of people, and that is
the largest group.
The largest group, the nurses.
Yeah.
Well, one of the things I think that we talk about too, and we literally had this conversation yesterday with Amanda Ray, who's a nurse practitioner for ERAS Cardiac at her facility there in Maryland. And we were talking about empowering our nurses to submit posters and do quality improvement projects. And we hate to use the word research, especially as a new grad. I'm sure you hear that and you're like, oh my God, I just need to get my feet wet, But, there are opportunities to do presentations at meetings and things like that. And I know in the critical care societies, there's been a little bit of, discussion about enhanced recovery. Were you involved in any societies or anything like that through nursing school, or any opportunities to hear more about enhanced recovery through that avenue?
No, I did honestly everything through Google. That was all my research, studying PubMed, a lot of different research databases. I just studied on my own. That was it.
I didn't know, like a lot of times we did posters in nursing school,
Right.
That we'd have to do for, even if it was just for our small group.
Right. Yeah.
So a good topic.
A very good topic to go. But you didn't really know about it until the very end of your training,
Right.
It sounds like.
Right. Right. Yep.
Yeah. Well, so anytime you want to submit a poster to a conference, Caroline, and you need help, let me know.
I'm all for
Willing
it.
to help you get it
Yeah.
out there. So we need to get nurses involved, way more involved. So definitely.
Absolutely.
So where do you see it going for you? So now you're in the ICU, and I guarantee you have ERAS patients that come to you, because I know them. Carolyn and I, full disclosure, work at the same hospital, and I'm one of the hospitals that I'm at. So I'm very familiar with the service lines. And so you will see those ERAS patients in the ICU, and you can have that hands-on and give feedback, because we want to hear feedback. But where do you see enhanced recovery fitting into your future as a nurse?
Not to do a total 180. I'm actually, even though I'm an adult nurse right now, I'm very interested in the pediatric enhanced recovery space. I've always had a passion for kids. I was just interested in doing adult medicine for a while, but I think that there is quite a gap in the literature about pediatric ERAS, and then even more so, a lack of implementation. So I think I see myself in that space, definitely going back to school at one point, and probably conducting research, doing a lot of pediatric enhanced recovery. I think that, kids, just as much as adults, need to get out of the hospital and back to being kids, socializing, doing all those things. That's kind of where I see myself. I don't know exactly what form that takes. I have a couple of different ideas, but more education and a lot of research.
Well, I think that's wonderful, and there is a gap in the pediatric enhanced recovery world. You're absolutely right, and we love pediatrics. So I think that's a wonderful trajectory for you, and clearly you're very passionate about that, and so you should go do the research.
Absolutely. No, you can do it. Well, what's great, I'm so impressed by you, Caroline. I mean, we get to meet a lot of people, but to have so much fire in your belly, just graduating, I know it was a long course of education for you, and being in the midst of your residency, but to still be so interested in continuing your education and more on to help promote and educate others, I think is really important. So, we would love to, we want to support you in any way, and hope that we can talk to you soon. As you were talking about your thoughts with pediatrics, and you had mentioned that you had surgeries yourself, some orthopedic surgeries along the way, and I imagine you're definitely younger than we are, but so might have happened in that, younger age. But there's that group of teenagers, that are still considered pediatric patients that are having orthopedic procedures. And you mentioned pain, management and the opioid crisis. And we know, and I've had conversations in my own practice with colleagues in the past, where we heard, a 16-year-old was going home with a bottle of, 80 Norcos or Oxys for that matter. So I think that there is definitely a place for your interest and to continue that. Well, Caroline, thank you so much for joining us. We really appreciate it. Good luck and everything that you're doing and working on, and hopefully there'll be some opportunity for you and Vicki to collaborate.
Yeah, it'll be interesting to talk to you more as you do get on with your career and into pediatrics and furthering your knowledge and just finding out where you're at.
Yeah. And if you have any ideas, I think too, about reaching nursing students, we'd love to help on that too. So.
Yeah, we would definitely. So keep it up. Keep it up. We need you to.
All right. Well, thanks for joining Top Med Talk. You can always find us on topmedtalk.com. We're on all of the social media platforms, LinkedIn, Facebook, Twitter. And we have Pockapalooza coming up. That's part of the EBPOM World Congress that we're doing. That is our perioperative care festival. If you haven't seen it yet, you can go on topmedtalk.com and type in POCAPALOOZA, Pockapalooza. I feel like I have to spell that out. I know. Who knows how to spell Pockapalooza? But check out some really great conversations there. We talked with people from around the world about perioperative care, perioperative medicine, and really fantastic conversations. So, Caroline, good luck to you. Thank you so much for joining us.
Take care.
Top Med Talk. Thanks for downloading Top Med Talk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, Top Med Talk is the broadcasting arm of EBPOM, evidence-based perioperative medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.